Welcome to On Deck with Mercury. I'm here today with Dr. Ben Schwartz. He's the Director of the Division of Epidemiology and Population Health for Fairfax County Health Department. Dr. Schwartz, thank you for taking time out of your busy schedule to sit down with us. So what does community spread mean? We hear that phrase talked a lot about, and what are the best things Fairfax County residents can do to contain and limit the spread?
Community spread refers to the transmission of disease from person to person in our community. Early in the course of this outbreak, all of the cases that we identified in Fairfax County were among travelers. We knew that they had come from China or other countries and had brought the infection with them. Then, next, we began to see some cases occurring within families, among family contacts. So there may be a husband who gets infected, and then their wife would get infected. Now what we're seeing is we're seeing cases that don't have a travel connection, don't have a family connection, where we don't know exactly where they came from. And what that means is that they came from the interactions that we have in the community every day. And so that's what community spread means. When there is community spread, the most important thing is that the community takes action to stop that spread. And I know when we have a new disease, people often feel powerless, right? And with coronavirus, there may be people who think this pandemic is just out of control and there's nothing we can do about it. And they couldn't be more wrong. There are things we can do about it. And so let me share with you the 4 things that we all need to do to slow down this outbreak. So the first, and we've talked about it already, is isolation of people who are sick, so they don't infect others in our community. The second is quarantine of their close contacts, so that if those contacts are infected, they don't spread the infection to someone else. The third important thing that we need to do is to wash hands and not touch our face. If you get the virus on your hands, you can wash your hands and kill the virus. But even if the virus is on your hands, as long as you don't touch your eyes, your nose, or your mouth, it's not going to cause an infection. You need to get the virus into one of those so-called mucous membranes in order for the infection to occur. So wash your hands, don't touch your eyes, your nose, or your mouth. So that's the third. The fourth is social distancing. The main way this virus spreads is through respiratory droplets that are expelled when somebody coughs or sneezes. And those droplets are affected by gravity. So if I were to sneeze, the gravity would bring those droplets down out of the air. And we know that about 6 feet is a safe distance. So you and I are doing social distancing just perfectly. If you stay 6 feet away from other people, if they're sick, if they might cough or sneeze at some unpredictable time, you won't get infected. So those are the 4 things: isolation, quarantine, hand washing and don't touch your face, and social distancing. If we do those 4 things, it can be incredibly effective. So one thing that everyone needs to realize is that infectious diseases are local. What happens in New York City does not have to happen here. And if we can do a good job with those 4 things, we will slow the spread, we will blunt the curve, we'll flatten the curve of this outbreak in Fairfax County, in Virginia, and in Vienna, and we can do it. We can, and we have to.
Thank you for watching. We hope that this has been very informational for you and helpful to the Vienna community. For more information on this topic, go to viennava.gov/coronavirus. And please monitor and watch all of our social media outlets where we will be putting out information about this topic. We hope everyone stays safe. Thank you very much.